I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Thanks for joining us for today's procedure. Our guests are Doctors Jasmine Toor and Nicholas Anastasio of Orthopedics and Joint Replacement at Mercy. Dr. Toor, you join us first.
Hi.
How are you?
I'm great, thank you. How are you doing?
Not too bad. Now, you're Director of Sports Concussions with Sports Medicine at Mercy. Now, why have a program specific to sports concussions? I mean, we've heard a lot in the news over recent years about CTE and among professional football players and that sort of thing, and concussions that can occur. Is the problem really that prevalent?
I think it definitely is very prevalent. I think over the years we've had more and more information and better recognition. That's one of the main things. And it's a lot of fear and worry because it's the brain. And especially in young athletes, children, we worry about the future. So I see a lot of patients with their parents, and the biggest fear is, oh no, what's going to happen in the future? Are they going to be okay? So over the years, the better we can recognize things, the more prevalent we note them to be. So that's one of the questions. Is it really more prevalent, or are we just better at recognizing it? Now, the importance of having a program like this is athletes, they get head injuries. We see it a lot, football, lacrosse, these type of things, and we worry long term. So it's really important because we want to make sure that we preserve their brain health over time. We recognize it quickly, pull them out of sports, and also get them back into sports on a correct treatment plan so they can get better and reduce the risk of any long-lasting effects.
Mm. I mentioned prevention is worth a pound of cure here. So you tell your like the young athletes who come in, if their sport requires a helmet, to be wearing their helmets, and
yeah, absolutely,
no matter what it may happen to be.
Yeah, definitely, yes. And one of my big points that I try to make when I see the athletes and their parents is I want them to be advocates too, because sometimes they might see a teammate or a colleague or a friend have symptoms of a concussion. And I've actually had one player come on his follow-up to me and say, guess what? I told my friend I think he has a concussion. He should talk to the coach. So it's great because we want to make people aware of the symptoms and what to recognize. And I think that's what will help athletes and kids getting back to what they love doing, which is they're playing their sport of choice. So.
Now, I see that you do occasionally blog on MedPage Today's Kevin MD site. Do you like writing?
Yeah, I definitely like writing. I've done a couple of articles in the past. I find it a great outlet because, working in the hospital, especially when I worked inpatient during the pandemic, is a lot of stress, a lot of emotions. I also practiced primary care for a few years before I went in to follow the passion of sports medicine. And you're sad, you lose patients, you have stress, you have hard days, you have better days. So it's nice to be able to share kind of the feelings that I have or stresses with other people that might be feeling in the same boat. I think one of my favorite things that I wrote was, when a patient dies, do you still cry? And it's about the emotion of seeing death on a day-to-day, or for depending on the specialty that you're not in sports medicine, we don't see that. But when we work in the hospital, and just how to deal with those type of emotions. And it's better to share it with other people than keep it inside, because I think having physicians and doctors that have better mental health, it's important. It makes you a better doctor for your patients if you can address those type of things yourself.
So you mentioned it's also, like, for yourself, a way to kind of relieve stress.
Mm-hmm.
Well, I also understand that you have an interest in gardening. You had started growing a vegetable garden that, quote, gave you a new appreciation for spaghetti squash. So why gardening? Is it for stress relief?
Yeah, so I have a house in Towson and had a lot of grass and space. COVID pandemic, we come up with all these new hobbies. All of a sudden we find ourselves with more time at home and things that you can try. And honestly, having something and growing it literally from the ground up, it's rewarding. And with Maryland weather these days, we're getting a very long spring and early summer. So got a lot of vegetables. And spaghetti squash, I saw the seeds at the store. I said, oh, that's going to be interesting. So you can do surprisingly a lot with spaghetti squash. And we got a whole bunch of them. Then we got cucumbers and tomatoes for months and months, all the way until November when we were, so it's been awesome. And it's nice to do something hands-on because I like to cultivate, no pun intended, that part of my brain as well, because I think it's important to be well-rounded and well-balanced. And you need stress relief, especially with the types of jobs that we have.
I've noticed some stories, because I deal with a lot of media, where they've talked about like how many calories you actually burn by doing gardening and so forth. In other words, is like doing gardening a way to kind of help you stay in shape?
Yeah. Honestly, yes, it definitely is. From a sports medicine perspective, we think about mowing the grass, gardening. Some of these things can get to a moderate intensity exercise, especially if you're digging, holes in the ground. It's a lot of work. So it's any exercise that you can do is good exercise. So I definitely account for that if people are, I'm talking to them about their injuries. I have plenty of people that just want to get back to gardening. And that's one of their complaints, especially in the end of the winter coming into the spring. Doctor, can you help me feel better so I can garden in the spring? All right, we'll do it. So it definitely does count as exercise and activity. So.
Well, I'm spending some of my youth pulling weeds, because my father liked to plant things and grow all sorts of types of vegetables. I can tell you, pulling weeds is a lot of work.
It is. That's why they make all these fancy tools now, but it's hard. It's hard on the body, the shoulder, the back, so we got to make sure we're in tip-top shape to not get injured.
I used to say pulling weeds should be outlawed by the Geneva Convention, but unfortunately, I couldn't get people to jump on board with that idea. So a favorite saying of mine is that variety is the entree of life. It's more than a condiment. It's more than a spice. It's the real essence of life. And I'm thinking you might agree with this mindset, because I see you do quite a lot of other different activities. Now, we've already mentioned gardening, but you play soccer, you paint, you explore the heavens with a telescope, you play the saxophone. Am I correct about all these?
Yeah, it sounds about right. The telescope thing, was a thing I definitely tried, and it's difficult to say I didn't have the telescope power to continue on or the time, but I really enjoyed it. I think, like I was mentioning earlier, using different parts of your brain and stress relief and having passions and things outside of medicine is important, because when the time we were in medical school, all we know is medicine or medical books, and residency, all we know is reading and getting sleep whenever you can, and those type of things. And as we kind of go into our practice, we have a little bit more free time, and it's important to, well, I don't know, is how I would put it, it's you kind of forget who you were before you go into medicine. And I'm trying to make a very conscious effort to remember all the things that I used to enjoy doing. Like, I've played soccer since I was 5 years old. I still play soccer. I'm still on a team. More drop-in these days, but I played, throughout residency, and I'm always active, and I enjoy exercising and playing sports. And I want to keep that going, because I think it's important to also practice what we preach to people as, primary care doctors, sports medicine providers. We want to have our patients, we want them to stay active and explore these things, and we should too, because it's very easy to kind of just get kind of sucked in on your day and take your work home with you. So it's nice to have a little bit of an escape. When I'm painting a picture, I use oil painting, I've done acrylic, and some of the stuff is pretty good, some questionable, but it's all I can think about when I'm doing it is in that moment, like I'm focused on the painting, and 2 hours could go by and I didn't really think about anything else other than what I'm doing. And sometimes it's nice, and hopefully you get a nice product at the end of it. So I enjoy it a lot.
No, I think it's very wise. I used to teach at Loyola University, and I used to tell students, I remember the students went through a Kardashian phase, where that's all they wanted to talk about. And I was saying, you don't want to look through life as like looking through a pinhole, where you're just seeing a very, very small piece of it. And that think of your mind as sort of like a crop. You want to rotate the crops. If you're always just basically doing the same thing, looking at the same stuff, you don't have that variety. What happens, you wind up with barren earth. You have to have different things and so forth going on in your life.
And yeah, definitely. And I think one of the things that kind of we cultivate around us is that if you're not good at it, it's not worth doing. But it's not the case at all. I think if you enjoy something, I don't mind my painting. It's all right. Sometimes they're good, sometimes they're bad. I dabbled in photography. I have a camera, and I like to take pictures when I go on vacation and edit them on Photoshop and things like that. And it's not amazing, but that's okay too. I enjoy doing it. So I think it never should be a barrier. You don't have to be perfect at what you're doing as long as you enjoy it and it gives you joy. That's important to focus on. So,
as viewers know, one regular feature of our program is a sort of show and tell. This is where the guests bring in something. Could be a book, could be a photograph, who knows what. But it's important to them in some way, says something about who they are and what they're about. Dr. Toor, what do you have for us today?
All right. So this is my first ever soccer trophy from when my dad signed me up for the league. I remember he was reading the newspaper in our living room, and I used to play at school for fun. And he signed me up for my first soccer team when I was 7 years old. And this was our first trophy that we ever got. And I still have it to this day along with all my others. This one is a participation trophy, so participating matters, And after that, some of my trophies, we, won championships, and I was on some bigger and better teams. But it all comes down to this, the original.
Did you find you liked soccer right away, or?
Yeah, I always had an inclination to play it, especially at recess. I don't know, it was always fun and exciting. It's active, and I used to, bring my soccer ball, just play in the schoolyard. It's just the good old days. So, and I think it definitely contributed to where I am today. I'm a sports medicine doctor. So my love of not just soccer, but all sports, soccer is my favorite, has brought me to that passion where exercise, whatever type it is, whether it's soccer or a sport or a gym or active gardening, it's important to keep people doing what they love, because I've had injuries before and it is just terrible. It's emotional. You feel life flashes before my eyes. So when am I ever going to play again? And I do. I still play to this day. So I kind of use that as an understanding when I see my patients. I understand how devastating any injury can be, especially if it takes away your activity and your ability to do something that's your identity. So I consider soccer as a part of my identity. And I kind of use this mindset on a day-to-day when I treat my patients. I understand how they're feeling from a medical perspective and a personal perspective. And my goal is to help people stay as active as possible for as long as possible with a little bit of modification. So it was nice to pull this out yesterday. I was laughing. It still has the original sticker on the bottom from, oh my gosh, more than 20 years ago. Oh my gosh, 1998, But it's very important to me. I'm going to keep them forever if I can.
No, I understand the concept of making it part of your identity, because that's how I felt about the sport of fencing. It's just my second spinal surgery in 2016, which I had both spinal surgeries here at Mercy. Worked out very well, but if I have any more problems, they're going to have to fuse me, and that was just a little bit too threatening of a thing to make me want to be able to continue. But yeah, it was definitely part of my identity for a long time. So you've kind of given us some insights into my next question, which is sort of like what you're not doing when you're in the exam room. But do you feel that with all these different activities, in addition to, of course, being a physician full-time, that you've got a good work-life balance?
Yeah, I definitely think I do. And it's something that we're always trying to work towards. Nobody has a perfect work-life balance. I often think about my patients, all the time when I'm at home. I still do. You can't stop, right? You come up with ideas, or, oh, maybe I thought about this thing and I got to write this down so I can talk to them about it. So it always is a part of you. But I think just taking time for yourself sometimes is important, because good mental health for your doctor, it makes them better for the patient as well. So it's hard if you're burned out and tired and exhausted. You can't be fully there emotionally and physically for your patients, and you want to be, right? So I think having anything to do, like some sort of activity that you enjoy doing, it doesn't have to be a lot of different things, but something that you can go to try to take a break and escape to help yourself feel better so you can be better for your patients the next day is really, really important, and for your own health, because we have to practice what we preach, right, to other people. So
What's going on in your field that you're particularly excited about right now?
Well, sports medicine. Well, it's a lot going on in sports medicine. So I'm really passionate about concussions. I think it's just the most rewarding feeling when you have an athlete, and people can be very, very unwell from concussions, and you see them on day one, and a couple weeks later, even the next week, when you see progress and you see them noticing that they have progress and getting them back onto the field where they can do what they love. It's just really, really rewarding. And there's so much more research, with concussion and things that we can do. Because back in the day, they used to say, turn off the lights, stay in the room, don't let them sleep. And that is the biggest myth ever. So now it's kind of, we want people to start doing things and exercise a little bit. And there's different treatments that we can do to help keep them at least somewhat active, even though they can't play the sport until they're better. So that's very great. And also ultrasound. I think in the last couple of years, it's been awesome. I do ultrasound guided procedures in the office, and we can do it in some diagnostic ways, and that it's good for people that are nervous about MRIs and things like that, or going to procedure rooms just for injection. So I think ultrasound is a great game changer for sports medicine because it allows patients to be definitely more comfortable in the office and have their pain taken care of. So.
We'll take a short break and we'll be back with part 2 of Medoscopy with Dr. Nicholas Anastasio.
Thirty-year-old Courtney Chagnon was an avid soccer player until she had so many knee injuries and surgeries she was forced to stop playing.
I've torn my ACLs, my meniscuses, patellar bands. I'm just bone on bone in my left knee now.
Now the gym is her only option for exercise, which has been an adjustment.
There are certain exercises I can't do, certain exercises that I have to be really cautious about.
So she sees Mercy Medical Center's Dr. Jasmine Toor, who helps her figure that out and how much to exercise.
What I like to focus on with my patients is how can we modify and still keep you active and getting that exercise in, but also doing it in a way that's not injuring or hurting something that's pre-existing.
For those who are not limited because of injuries, she recommends this when it comes to how much exercise.
The goal is 150 minutes of moderate intensity exercise a week. So it's kind of what I tell patients sounds very overwhelming when you say 150 minutes, that's 2.5 hours. So we like to say it's completely a goal that we want to try to build up to.
She says that 150 minutes a week can be divided over 7 days. You can try to do 10 or 15 minutes of exercise on your breaks throughout the day. So what is moderate intensity exercise?
Describe it as getting your heart rate to 50 to 70% of maximum, or you're exercising to the point where you can still speak, but you have to work a little harder.